Good afternoon everyone. Myself Dr. Apratim Chatterjee. I am a stroke and interventional neurologist attached with AMRI Mukundapoor Hospital. Stroke is a disease of the brain in which a patient suffers an acute neurological deficit. It may be manifested, as you know, by the mnemonic FAST, where F stands for any deviation in face, A stands for any weakness in arm or limb, S stands for any change in speech, sudden onset change in speech, and T stands for time. This time for stroke management is very important because if the patient of acute stroke comes within 4.5 hours to a stroke ready hospital, he can be thrombolyzed, where he is given an injection through his vein by which the clot inside his brain lyses and the patient recovers. Also, there is a treatment called as mechanical thrombectomy, where the patient is taken to the cath lab and with the help of a stent or with the help of a suction tube, we are able to take the clot out of his brain and recover the patient. If appropriate and time-based management can be done in a stroke-ready hospital, then such patients can be saved from permanent morbidity and mortality. We are happy to say that AMRI Mukundapur is now a stroke-ready hospital. We are able to cater both thrombolysis as well as thrombectomy to our acute stroke patients. Not only that, we are about to start and have already started a stroke clinic where myself, a stroke neurologist Dr. Apratim Chatterjee, along with my colleagues, which comprises of physiotherapy department, speech therapy department, swallow therapy, cognitive assessment, we 5 form a team and make a clinic called a stroke clinic, which runs every Thursday at AMRI Mukundapur for every patient who has suffered a stroke, in which a comprehensive stroke care is given, because we think stroke is not only a problem to be dealt by a single neurologist, it affects your mind, it affects your speech, it affects your limbs, your functionality. Hence, not only medicines but also rehabilitation program, cognitive and psychological counseling for your mind is necessary so that any stroke patient can be helped to go back to his previous occupation or job. Thanks a lot.